This presentation explores the wicked problem of malaria and its effects on a range of stakeholders. It analyses the entrepreneurial and innovative applications implemented to generate a solution by the Bill and Melinda Gates Foundation. The solutions for eradicating malaria and potential implications for stakeholders are discussed, followed by a reflection of entrepreneurship and innovation utilised in solving this wicked problem. Malaria. If you say it quickly, it doesn't sound more serious than the common cold, right? But about half the world's population is currently at risk. In 2013, more than 500,000 people died from malaria across more than 100 countries, and in Africa, 1 child dies every minute from malaria. It also affects communities economically through reduced productivity, low gross national income, and poor economic growth. Amplifying the problem in poorer countries is the high cost of medicines and hospitalisation. Malaria is caused by mosquitoes that are infected by parasites. Mosquitoes then transmit the infection through biting humans, who, once infected, can transmit the infection back to healthy mosquitoes, increasing the spread further. Despite a decline in the number of deaths and new infections, hundreds of millions of cases are still identified each year.
Malaria is a problem that keeps on changing the more it is addressed. Changes occur through insecticide and drug resistance, varied management and health practices, rising drug costs, and the increasing pressure on governments. It spans many nations, borders, and governments. As the number of stakeholders increase, so does the number of different approaches, definitions, and solutions. Malaria is a wicked problem because it has issues that are complex and tangled. There is no easily identifiable solution, and significant progress has not been achieved thus far. Some factors fueling this complexity include the lack of access to potable water, adequate healthcare, diagnostic tools, large-scale resettlement of people and increasing urbanisation, and difficult to reach populations. The Bill and Melinda Gates Foundation is the world's largest private foundation dedicated to improving global health. Government, non-for-profit and commercial recipients of the foundation's grants use funding for a range of activities, from supporting research to delivery of healthcare services, medicines and equipment. The Gates family has had a strong history of giving back. The values of volunteerism and civic engagement were instilled at an early age. In 1997, Bill and Melinda were galvanised into action after reading an article about children in poverty-stricken countries at risk from diseases. They recognised that their significant wealth and philanthropic nature provided an opportunity to eliminate a preventable and treatable disease. Recent progress worldwide attributed to timely diagnosis and treatment using reliable diagnostic tests and effective drugs motivated the foundation to urge an international push towards malaria eradication.
There are many organisations around the world working on the solution of malaria eradication, and to date only little progress has been made. The increasing number of stakeholders increases the likelihood of differing definitions of the problem, differing solutions, and differing approaches. The many factors fueling the complexity of malaria as a wicked problem impede progress towards identifying programs leading to a solution. Bill Gates warns any progress already made could be in vain without an immediate, coordinated, worldwide effort to eradicate malaria.
Eradicating malaria involves a range of stakeholders including the Bill and Melinda Gates Foundation driving for a solution, individuals, their families and communities affected by the disease, charitable foundations, researchers, medical staff, pharmaceutical companies, governments and communities dependent on grant funding. The number and complexity of stakeholder relationships contributes to the wicked nature of the problem. The Gates Foundation is implementing a strategy for malaria eradication by encompassing 3 areas of focus: demonstrate and accelerate a path to elimination, invest in new interventions, and mobilise support. Accelerating the path to eliminate malaria includes the Foundation refining strategies for accessing special populations for diagnosis and treatment, Funding will be allocated towards new interventions, new diagnostic tools and techniques, and new methodology for monitoring and measuring outbreaks. Investing in new interventions will help the development of vector controls, transmission blocking vaccines, and more effective medications, as well as diagnostic tools and techniques, and new methodology for monitoring and measuring outbreaks. To mobilise support, the Foundation focuses on delivering support to special populations, where cultural barriers, logistical difficulties, or political turmoil impede service delivery. The Foundation is capably applying entrepreneurial thinking and innovative techniques to the search for a solution to this wicked problem. It has the resources and determination to achieve its goal, the global eradication of malaria.
To make foundational, lasting change, solutions must be truly transformative. The Foundation acknowledges that interrupting malaria transmission is not sufficient to achieve eradication. Instead, an innovative approach is required that results in the parasites that cause human malaria to be eradicated from the human population. To achieve this transformation through its three overarching areas of focus, the Foundation uses entrepreneurial thinking concepts for dealing with the wicked problem. Design thinking, where understanding problems and using existing tools in new ways is integral to the solution design, and open innovation, collaborating with many other organisations in a quest for a solution.
The Foundation seeks transformative innovation and long-lasting change, knowing the eradication of malaria will have significant impacts on many stakeholders worldwide. The Foundation applies design thinking to fully understand the social, cultural, economic and regional constraints that occur in communities stricken by malaria. It uses open innovation to share findings and collaborate across the globe with a wide range of organisations with an interest in eradicating the disease. Design thinking can, however, be a lengthy and iterative process, and there is an imperative to resolve this solution quickly. Open innovation can limit engagement of commercial entities as they strive to protect and commercialise new ideas. Increases in commercial malaria data driven by open innovation may create noise in the research community and may prove unreliable.
The challenges associated with malaria present a true indication of a wicked problem. Malaria traverses borders, is not selective in its victims, and is endemic in areas that are least able to manage the outbreaks. It is a social and economic problem in the developing world. Past solutions have resulted in new and unforeseen problems. Vector resistance to drugs and insecticides add to the dynamics of any proposed solution. A multifaceted approach can assist resolution. It is possible that the Foundation is focusing too closely on existing solutions and their applications, and could focus more on new and emerging techniques. Additionally, as a philanthropic organisation, a succession plan is recommended to ensure this type of vital research, development, service delivery and advocacy continues beyond the life of the organisation.
It has been enlightening to discover the entrepreneurial tactics the Foundation is applying to help solve the wicked problem of malaria. Design thinking and open innovation can help on the path to a speedier solution, and one that meets the needs of all stakeholders and matches the requirements of many different communities worldwide.
We are enthused by the efforts of the Foundation and believe this wicked problem is solvable given the right level of focus internationally, economically, culturally and politically. Wicked problems, whilst they may seem insurmountable, can be solved, but it takes a strategic approach. We look forward to witnessing the Gates Foundation use its entrepreneurial roots to achieve eradication of malaria within our generation.